Hello class, my name is Hako Bastran and today I'll be presenting about prostate cancer in our medical terminology course. First, let's begin with the definition of the prostate gland. The prostate gland is the gland that surrounds the neck of the bladder in males and helps secrete fluids that nourishes and protects sperm. What is prostate cancer, you may ask? Prostate cancer is defined as a malignant tumor of the prostate. This is due to either genetic mutation of a gene, DNA errors before dividing, abnormal amount of androgens, which are male hormones, and cancer-causing chemicals that can cause prostate cancer. Here, you have two images of the prostate. One that shows a normal prostate and the other which shows prostate cancer. The image on the left shows what happens when a tumor begins to grow in the prostate, which causes the prostate to enlarge and press on the urethra, inhibiting the flow of urine, compared to the normal prostate, which is not enlarged and is not blocking the flow of urine. The image on the right shows a normal prostate cell only, and on the bottom shows prostate cells that have become cancerous and are marked, meaning a high severity of inflammation and tumor growing inside the prostate, associated with a darker purple color rather than a pinkish hue. Now, let's move on to the 5 types of prostate cancer. The first one is called acinar adenocarcinoma, the most common type of prostate cancer. This develops in the gland cells that line the prostate gland. The second type is the ductal adenocarcinoma. This type starts in the cells that line the ducts or tubes of the prostate gland and tend to spread and grow more quickly than the first type of adenocarcinoma. The third type is called transitional cell cancer. This starts in the cells that line the tube that carry urine to the urethra. This type of prostate cancer starts in the bladder and spreads into the prostate. The fourth type is called squamous cell cancer, which develops from the flat cells that cover the prostate and are known to grow and spread more quickly than adenocarcinoma. The fifth and final type of prostate cancer is called small cell state prostate cancer and is made up of small round cells, which is a type of neuroendocrine cancer. Now, let's explore the symptoms of prostate cancer. One symptom of prostate cancer is burning or pain during urination, and this is because of the tumor pressing against the urethra. Another symptom is a loss of bladder control, which means you cannot hold your urine for long periods of time. Another symptom of prostate cancer is hematuria, which is blood found in the urine. Also, a sign of prostate cancer is a decreased flow of urine and difficulty urinating. Other signs of prostate cancer are blood in the semen, painful ejaculation, or the swelling of either the legs or the pelvic area. Let's move on to the diagnosis of prostate cancer. The two main ways of screening prostate cancer are usually combined together to identify early stages, are the digital rectal exam or DRE and the prostate-specific antigen test, or for short, PSA. The DRE is when a doctor inserts a gloved, lubricated finger into the rectum to examine for any abnormalities of the prostate. The PSA test is used to sample blood to test and be analyzed for PSA, which is a substance naturally produced by the prostate gland. If any abnormal levels are found in the area, that can be a sign of prostate cancer. The diagnosis, however, are used to determine whether the person has cancer or not, is first called ultrasound, which is a small probe that is inserted into the rectum and by which using sound waves to create a picture of the prostate. Another form is to collect a sample of prostate tissue by doing a prostate biopsy using a thin needle to collect the sample and analyzing it for cancer cells. An MRI fusion may also be used to form images from an MRI scan and transcendal ultrasound to create a more precise 360-degree map of the prostate for better analyzation. Treatments of prostate cancer. Radiation is the first treatment option for prostate cancer, and it uses high-energy particles to kill cancer cells. Surgery for prostate cancer is also a common choice to treat prostate cancer if it hasn't spread outside the prostate gland. The main surgery that is done is called a radical prostatectomy, which a surgeon removes the entire prostate and tissue surrounding it. Another treatment option for prostate cancer is called chemotherapy. Chemotherapy is used sometimes if the prostate cancer has spread outside the prostate gland. Another form of treatment is hormone therapy, which is also called androgen deprivation therapy or ADT, which reduces the levels of male hormones called androgens within the body to stop the prostate cancer cells from growing. This concludes my presentation for prostate cancer. Thank you for listening to this PowerPoint presentation, and I hope you have learned more about the symptoms of prostate cancer, diagnosis, and treatments for this potential disease.